We are Just Show Up. I'm Angelica, or Gary, Anish, Hong, Pranjal, Victor, and Saruchi. So the problem we're looking at today is very specific to the no-show. We know that well-being starts with you, the individual. What we see is that there's a perception that recovery can be expensive. It's inconvenient to reach the clinics, long waiting time. And as we know from 2020, rehab and recovery and clinics have often been closed during COVID. So this actually is a cost burden of $150 billion a year. These missed appointments and last minute cancellations really impact the US healthcare system. And specifically, this looks like 3 million older adults are actually admitted to nursing homes. And this itself costs another $14 billion a year. So in fact, the real root cause is increased family and caregiver stress, family work conflict, burnout for caregivers. Myself, having studied medicine and also being a product manager, I can tell you that the real gap is in the shared knowledge in real time between patient, caregivers, and the clinician. And we're really here to address that. Our solution with Just Show Up looks at recovery through goals, journeying through progress reports. We also know that a big cause for readmit is pain, as well as medication adherence, as well as lack of education. So we really want the caregiver and specifically our patient users to have all of the information at their fingertips. So the solution, technically, we use a mix of Flutter, Firebase. We're also in the process of using Cardinal Kit for our SF12 survey, which is a standardized activities of daily living questionnaire. You can see our GitHub below. And for the clinicians, many of us, 3 of us on this team are medical students in training. We know that it's very important for each clinician, care provider to be able to summarize a patient's progress, also get their patient information, really understand the onboarding process. Huge opportunity for us is that as of November, we know in the US that remote patient monitoring is now a requirement and is easily integrated into a patient's recovery plan. So benefits, it's holistic, it's self-efficacy, feedback is real time. We're also really looking at habit change for behavioral health for all these other comorbidities. And our value proposition, we're a very diverse team, and we really looked at the goal of ensuring that our payers, our employers can save at least $1,500 a year. So for every $37 spent, the return on investment is easily 70% using our solution. This adoption strategy is all about a sticky platform. We start with our mobile app in both Android and iPhone. It's a business-to-business go-to-market. We're dealing with also looking at pain points for self-insured employers and really leveraging partnerships with our health plans. The business model, as I said, is very easy to look at from a SaaS subscription model, $37 per employee per month. And specifically, this is really being sold to employers as part of our MVP. In terms of future revenue generation and impact and innovation of our business model, we really want this to be an in-app purchase from the business-to-business consumer, as well as all of our healthcare sponsors in our ecosystem. So very quickly, this quadrant really tells you where we're at as a market. Market growth, we know in telehealth is going to increase by over 18%. Revenue forecast into 2027 is close to $5 billion. And as I said, the market size value in the US alone is already over $1.56 billion. So what we're really hoping to see in this growth through 2021 is a lot of opportunity. And you can see this is where our revenue will go into 2025. Competitive edge, we're a super dynamic, multicultural global team. We know the value to the consumer of savings as well as to our employers. And we're all here at MIT Hacking Medicine because we're believers in innovation in medicine. So we also took a look at our competition. And this is who we are. Thank you so much.